many of them during the discussion. And we will just, before to engage the discussion, we'll have additional patient testimonies. I guess patients engage in some research projects.
Yeah, and our first speaker is Kris Wood from the UK. So Kris.
Good afternoon. There's been more progress in type 1 diabetes research in the past 5 years than in the past 50. This statement is echoed by various staff at JDRF, and therefore the current research landscape is probably the most exciting it's ever been. But how many patients actually know about these projects? We might need to be patient for the cure, but research into the likes of encapsulation, smart insulin, vaccines, and beta cell regeneration are all a reality. In March 2012, aged 25, I was diagnosed with type 1 diabetes. After noticing symptoms over a few months and putting it down to stress, my sister eventually made me go to the hospital. The doctor that diagnosed me said my sister had saved my life, as I was away from a diabetic coma. I'm forever in her debt, and don't I know it. Knowing nothing about diabetes, I was sent on my way after 3 days in hospital to start my new life of testing blood, injecting insulin, and everything else that goes with this life-consuming condition. However, I've gained strength and resilience through my involvement in research, and as a result, I've spent the majority of my type 1 life participating in projects. Within a month of being diagnosed, I was on my first clinical trial, and this is where my interest in research began. The initial frustration of not being able to cure or do anything about this condition was a huge motivation for me to take part. This project was called Proinsulin Peptide Immunotherapy in New-Onset type 1 diabetes, which involved trialing a new vaccine which they hoped to trigger an immune response to protect against type 1. This was another reason for taking part. The genetic link of type 1 diabetes was a big concern for me in those early days. What if I have children in the future? What about my sister? A vaccine to prevent anyone else going through this was a big motivation. The study involved a demanding 6 months of fortnightly visits, followed by 6 months of monthly observation visits, with lots of injections, lots of blood tests, and lots of mixed meal tolerance tests. This was by no means enough to put me off, and following the project, I didn't need another reason to do any more research. I was hooked. As this phase of the project comes to an end, it looks promising that they will be moving on to phase 2 soon. My second project was called Developing Corneal Confocal Microscopy for Human Diabetic Neuropathy. This project seeks to discover if a non-invasive eye test looking at the nerves in the eye could be used to diagnose diabetic neuropathy. This is a picture of the technology in action. The project required an annual visit for 4 years, and I've just completed my second year, where I was put through a series of tests on my nervous system and eyes. This included testing my ability to sense pain and touch, vibration and temperature, using a pointed tip, tuning fork, and warm and cool metal rods. Nerve damage was assessed using nerve conduction studies, and an ECG tracing of the heart was determined to determine blood pressure during movement and breathing. And a number of eye tests were conducted to assess cornea sensitivity, the number of nerves at the front of the eye and from the retina at the back, and also to test my tear ducts. When I first heard of this project through the JDRF UK website, my first reason was taking part was because I was interested in being tested for neuropathy. Although still relatively newly diagnosed, it's still reassuring to know that there's been no damage caused by my type 1 diabetes. It also interested me as this is technology that's already been trialled in clinics and will no doubt become part of my annual diabetes checks in the future. My third and most recent project is called the Adaptive Study of Interleukin-2 dose on regulatory T cells in type 1 diabetes. It was trialling a potential treatment to extend the honeymoon period using an existing molecule in the immune system that regulates T cells. I was required to give blood for 8 consecutive days, as shown in these pictures. So as you can imagine, my arms were looking a little bit bruised by the end of that. This was an exciting project for many staff at JDRF UK, including the CEO, Karen Addington. If she gets excited about a project, then I get excited, so I was signing up straight away. The more I looked into it, the more interested I was interested to take part. Unlike other projects, it wasn't blind, and it had already been predicted that the outcome of the drug in a clinical setting. This allowed me to ask a lot of questions, unlike the vaccine project, which was double-blinded. By feeling more included in the process, I was able to blog and give an insight into my experience of the trial. I was required to visit Addenbrooke's Hospital in Cambridge every day for 8 days, followed by 3 observation appointments over the course of the next 2 months. Again, this is quite demanding on my time. What was the most exciting about this drug is that it put my type 1 into remission for 8 days. So basically, I didn't have the immune response on my beta cells for 8 days. Although I didn't see the benefit to my levels or insulin requirements, I was reassured by the doctors that was the case. So it was really exciting to see this positive outcome, but also it was a nice feeling to know my beta cells had a bit of a rest for 7 to 8 days. Like I said, this phase of the trial has already proved successful, and I've been invited along to the next phase later this year, which I'm really excited about. Overall, all the research projects were very accommodating, but my personal circumstances made it a lot easier. I was either self-employed or working for JDRF, so fitting in research between work was never a problem. Due to the schedule of appointments, occasionally I'd be in clinic with other patients, and it always made the experience more enjoyable just from a social perspective. During the recruitment process, the risks and benefits were always highlighted and discussed, and I was given time to think about it. The benefits always outweighed the risks. My endpoints for research have differed depending on different projects, and I'll come to those in a bit, but the current circumstances always played a big part in that. But overall, I see research, whether it's treatment, prevention, or developing new technology, all helps towards the ultimate goal of a cure one day. There are a number of benefits I see in taking part in research, which I don't believe are communicated very well until a participant is already interested in taking part or already recruited in the trial. Psychologically, seeing and meeting other people with type 1 can have a positive effect on your outlook on type 1. And that was really important for me in those early days to see other people and meet other people with the condition and see them live many years without any problems and do whatever they want every day. So it was a real nice thing to see in those early days after being diagnosed. And I've never felt like I was the only person with type 1, which I know a lot of people do feel like that way. The sense of playing a part in the ultimate goal of a cure one day is very rewarding. Research is the only way we're going to be able to cure type 1. While participating in research, your care is taken over by the research team, and as a result, the level of care is much more than what most people would experience in their type 1 life. I really valued this so soon after diagnosis, and it helped me develop an understanding of my type 1 from the very start. Also, as part of most projects that I've been involved in, they've put me through a number of health checks and screenings. Again, this is something you don't get as part of your care of type 1, in the UK at least. So having those extra checks was just another kind of reassurance that everything's okay and working fine. From an educational point of view, learning how the body works and how type 1 fits into this helps you understand and manage your condition better. And on projects that span over months or years, like my first project I explained was over 12 months, your diabetes management is closely watched by professionals and fine-tuned. So it's those first 12 months I had perfect control due to a bit of honeymooning, but also from the excellent kind of care and advice I'd get from these professionals who were the top of their game. So most of these benefits I identified myself while taking part in the projects, and it's something that I try and explain to many people that I come across. However, there were other benefits communicated beforehand by the research team that were individual to each project and that outweighed the risks even further. So the vaccine research that I explained first, there was a possibility of extending my honeymoon period, and I was also advised that the research team by the research team that having the superior care very early in my diagnosis would get me into good habits from day one. The second project I explained, the immunotherapy research, it had already been proved to put type 1 into remission, which obviously seemed very exciting and I wanted to give it a go. and the added benefit of a suite of health checks, including ECGs, X-rays, and a number of blood tests, was again just reassuring that I can have all those tests which you wouldn't normally get. And in fact, actually one of these tests picked up I had a calcium deficiency, and although it was just a blip in one of the tests, it's good to know that that would have been dealt with before it progressed any further. And the neuropathy research, I had the opportunity to have a neuropathy test every year for 4 years, and I'm not going to return that down, so that was also reassuring. So with all research, there are barriers for taking part. Even the semantics of words like clinical and trial and research often are perceived to be negative through experiences. And even calling people patients, it's not something I like being called. I don't see myself as a patient when I'm on research. I'm a participant, I'm taking part in the research. So those kind of words can almost put a barrier up straight away. Traveling to the clinic and taking time off work will always be a problem for most. Again, like I said, I didn't have that problem with my flexibility with my work. So even in a weekend appointments would open up research to a larger population. Everyone has a risk threshold which changes over time. It can be influenced by current circumstances and everyone's different. However, my experience talking to people with type 1 is that the attitude to risk is much lower than the professional community believe. People with type 1 are frustrated with their condition and they want to do something about it, but research isn't made available to them easily. But by far the biggest barrier is the infrastructure. It isn't equipped to make it easy for people to find out where and how to get involved in research. There isn't one obvious central place to find out about what research is currently going on, the results, the case studies from patients, and the progress of projects. I've lost count how many people have asked me how to get involved in research, and my answer's never simple. So it all kind of comes down to communication, I believe. Someone said to me recently, research into type 1 hasn't advanced since the discovery of insulin in 1921. I think this statement is a good example of how little the community knows about the developments in research. It needs to be communicated on a wider scale, it needs to be transparent and at a level that people understand. Whether it's good or bad, research project progress and results need to be communicated. Demonstrate how research is not cheap, quick or easy, therefore highlighting the need for more patient support and engagement. Like I've just said, the need for one central place for all diabetes research would make it easier to keep updated on progress, results and case studies from patients. Opening up communication between patients on the same trial or different trials creates a community and therefore engages patients more. Using patients as advocates and recruiters following their participation in trials, humanize the benefits of research and also the risks. Patients are the best spokespersons for this purpose. They are the ambassadors of research. Since being diagnosed, I've directly recruited at least 8 people onto major clinical trials just from talking about my research. And that's outside of work, just talking to people day to day. And given my experience has then led to people getting signed up. And I lost count how many referrals I've actually passed on to clinical trials as well. So it's the most powerful thing someone can do to recruit and engage people in research. Include patients in the whole process so they feel valued. I've only really experienced this through asking questions and being interested. Most of the staff that I came in contact during taking part in the trials didn't know all the details of the research, which I found quite frustrating. I had hundreds of questions about what they were injecting me with and what they were taking out of me and what they were prodding me with, and sometimes they didn't know all the answers, and I kind of wanted to know. Maybe that's just me, but I think a lot of people wanted to be more involved than sometimes what you are. Also, communicate research through new media. Social media is massive now in the diabetes online community. Using the internet and using video to explain things easily. Research is not an easy thing to explain. It's complicated, it's difficult, and it's above people's knowledge a lot of the time. So use new media that people are using now to try and communicate that better. The project that I was on in Cambridge used the internet and social media to promote their recruitment, and quoting the chief investigator of the study, he said, "In my experience, this has been one of the fastest recruiting trials for immunotherapy and has been carried out so far worldwide. were 1 year ahead of schedule. So using social media and their website, they've been able to recruit the quickest ever possible around the world. And as there's so much care and support included in research projects, a quick win would be to encourage research as part of a patient's clinical care plan or during clinical appointments. The first project that I was recruited on was actually first made aware to me during a clinical appointment, but then since then I've had tens of appointments in the 2 years I've been diabetic, and not once has research been mentioned, which for me, it's helped my condition, it's helped me physically, mentally, emotionally to be part of research. So why isn't that part of your care plan? So overall, I don't believe risk is the biggest barrier. Personally, I'm quite willing to take risks as a result of being self-employed for a number of years. And in just 4 weeks, I'll be taking the biggest risk of my life, climbing Kilimanjaro for JDRF. I think the frustration of living with type 1 also reduces the perceived risk for most people. So the focus needs to be on access to and education of research through improved communication. As a result, patients need to be engaged, motivated, and advocates of research. A UK survey conducted by JDRF in 2013 found that 77% of people with type 1 diabetes have never been given the opportunity to take part in research by their clinical team. And a staggering 96% of those people wanted to take part. So now I've been involved in a vaccine project, a treatment project, and a complications diagnostic project. I want to continue my involvement in research, and going forward I'd love to be part of some exciting research that's a bridge to a cure, such as smart insulin or beta cell encapsulation. So if you know any projects, let me know.
Thank you, Kris, for those invaluable insights. And we'll come back and talk about this during the discussion period. Yes, please.
Is that okay? I'm climbing Kilimanjaro for JDRF, like I said. One thing I've found out about research is that it's extremely expensive. So I wouldn't be doing my job as a fundraiser at JDRF if I didn't plug my own fundraising page. So sorry to kind of interrupt there again. So if you do, you can spare a few euros or a few pounds, please visit my Just Giving page, justgiving.com/KrisOnKilly. And I've also blogged about my experience on research on my blog, which is diabeticbanana.org. Merci.
Okay, good luck, Kris.
Thank you.